At Sierra, discover great deals on top brand workout gear, like high-quality bikes, which might lead to another discovery. Getting back on the saddle isn't always comfortable. Good news is Sierra has massage guns. And chafe wipes, too. Discover top brands at unexpectedly low prices. Sierra, let's get moving.
Hello there, I'm Nurse Mo, and this is the Straight A Nursing Podcast where I teach concepts and share tips on how to thrive in school and at the bedside. Welcome back to Mo's Monday Minute, where I share a quick tip that you can start using right away. And this week I want to talk about beats that aren't perfusing. So let's say you've got a patient on cardiac monitoring, and in that case, sometimes there's a tendency to just rely on and believe the monitors more than anything else, right? We look at that and we take it as fact. Well, actually, you have to determine if beats are actually perfusing, because the EKG is not going to be the best indicator of this. It's going to show electrical activity, not necessarily mechanical capture and the heart and the ventricles actually pumping and causing perfusion. And then another instance where this comes up, and this actually happened to me not too long ago, is that someone who had used the monitor prior to me had set the amplitude very, very high for that cardiac monitor. And what happened was the monitor was reading the T waves as QRS complexes. So it was actually doubling the patient's heart rate. So if I see a heart rate of, let's say the patient's heart rate was 80, because it's doubling the heart rate because it's counting the T waves as QRS complexes, does that mean the patient has a heart rate or pulse rate of 80 beats per minute? No, because only half of those are actually QRS complexes. The patient's heart rate was actually 40 beats per minute. So I'm going to tell you a quick tip on how you can determine if your beats are perfusing. So one very quick way to do this is to look at the EKG monitor, but also look at it in tandem with the pulse oximetry sensor. These two numbers should correlate, and they won't always be exactly the same, but they should be pretty darn close. If they are off by any significant amount, this is probably a case where some of those beats that you see on the EKG tracing are not actually adequately perfusing the tissues. And if you have a patient who's on EKG monitoring or telemonitoring, but not on continuous pulse oximetry monitoring, you can also just watch the monitor, see what the rate is showing on the monitor, and then manually count by assessing the radial pulse. And hopefully those two numbers match. If they don't, again, you've got a situation where not every beat is perfusing. And where this can be especially useful is when you are evaluating a patient with PVCs. And to a degree, also PACs, but it's more the PVCs where this comes into question, to determine if those PVCs are actually perfusing beats. Because guess what? Sometimes they are not. So again, you might think your patient's pulse rate is 80 when it is in fact much less than that, depending on the frequency of those premature ventricular beats. So verify with correlating the EKG tracing with pulse oximetry, the pulse rate on the pulse oximetry, or a manual count of the radial pulse. I hope this helped you improve your practice, and I will see you again soon. Bye for now. This podcast is brought to you by Straight A Nursing, a proud member of the Airwave Media Network. For more educational podcasts, check out airwavemedia.com, and for more nursing-related content, go to straightanursingstudent.com.
Have you ever wished that you had a direct line to your pediatrician to ask all the questions that constantly crop up while parenting? We sure have. That's why we launched the Bites of Health podcast. Every morning, we'll answer a commonly asked pediatric question in 5 minutes or less. You can tune in while you're making your second cup of coffee or from the school drop-off line. So be sure to tune in to Bites of Health, streaming now.